Just make sure I have everybody in here. Devanya, did Devanya get in here? Nope. Regine is here. Yamila, did Yamila make it in here? Oh. Okay, so we're just waiting for a couple of students. Okay. Okay, what was the next question?
So all of us, our group, we got all together and we figured out what we're all gonna do. And we all got assigned like our parts, but we have one person that didn't reply. So what if all of us does our part except for one person?
So you need to email me and let me know the student that's not replying, so that I can reach out to that student. Have you assigned that student a particular topic?
We haven't seen him in our class the last couple of weeks, so I don't know if he dropped the class or not.
Who's the student we're talking about here?
Jay Laquan.
Okay, no, he's still in the class. So yeah, okay. So somebody in your group email me about the conflict you're having, and then I'll reach out. Okay.
Okay.
All right. Thank you for bringing that up. Okay. Any other questions about the project? Remember that I've got a couple of emails this week. Remember that everybody has to submit a copy. I realize I'll be getting 4 or 5 copies of the same final project, but everybody has to submit. Okay? And that's so it has an entry into the grade book. Okay, I can't just have one person submit. Everybody has to submit.
Mm-hmm.
Does that make sense?
Yeah.
Okay. Okay, so back to the project. Has everybody, it sounds like there may be a group, if not 2, that they haven't done an email yet to reach out to everybody. Is that right? So what are we in week 5? So the project is due in a couple of weeks. So for those groups that have not reached out to each other, I would suggest that you get going on that. Okay. A couple of things for next week. Today we're gonna do the quiz. Then we're gonna cover weeks 4 and 5 content from last week, since it was exam week, and this week. Next week, we're gonna pull out the next week we'll cover the week 6 content, but we're also gonna pull out the HESI prep guide. Okay, we're gonna pull that out next week, and we're gonna start filling it out if you already haven't. Okay, because after next week, that's weeks 1 through 6. So there's a lot of information on that HESI prep that you should be able to complete. All right, so mark that on your calendars for next week. We're going to pull out that HESI study guide. The other thing we'll do next week is we'll do a quick review of your concept guide for exam 2. Okay, we'll pull that out as well.
Next week won't be quiz, Miss Marvel. Next week won't be quiz then.
You have a quiz. Yeah, you have a quiz next week.
Okay.
Yeah, you have a quiz next week.
Okay, I'm sorry. I have one more question about the project. So the name that's by our group, that's the vulnerable population that we're gonna do our presentation on.
It's a disease, I think they're doing it on.
Yeah, it's a disease, but like on the actual. Okay. I think I'm confused. I don't know. I'm over it. I just asked at the end of class, but I'm getting irritated. It's okay. You can just go ahead and.
No, you've got 2 projects, okay?
Okay, I think that's why I was getting confused.
You've got 2 projects. You've got a group project that's due in week 7. If we have time in week 8, will do mini presentations of that project. Okay.
Okay.
Then you have a second project that's due in week 10. Okay, well, your HESI prep is due in week 9, right? In week 10, you have your individual big project. It's called your vulnerable populations. That is your PowerPoint.
Hmm.
Okay.
Okay. Okay.
Your infectious disease group project is a paper. Okay, your vulnerable populations is a PowerPoint of 6 to 8 slides.
Mm.
It's a research project about a vulnerable population in your community.
Okay. I
Okay,
understand.
does that make
Yeah.
sense?
Yeah.
Okay.
And we can choose anyone we think is what we want to do it on, or have you assigned anyone us
No,
those?
if you go into week 10 and read the guidelines,
Mm-hmm.
it gives you numerous suggestions of vulnerable populations that you can do.
Okay.
So
Thank you.
go into week 10 and read that. Okay.
Okay. Mm.
With regards to exam 1, overall, you guys did great. Very proud of you. I appreciate all the hard work and effort that went into the exam. Okay, the grades for most people showed. I have reached out, well, I've sent an email out that anybody that scored below a 78, I highly encourage you, if you already haven't, to reach out to me and review the exam. Okay. I've already had numerous tutoring sessions this week with students from all my sections, and I believe they're very helpful. We review the concepts missed. We go through some of the questions and figure out what kind of questions you missed. We talk about test taking strategies going forward. So I believe they're really, really helpful. At least the students, I believe, think they're really helpful. Anybody that scored above a 78, if you would still like to review what you missed, that's perfectly fine. Perfectly fine. I'm happy to meet with you. Okay, so once again, I'm extending out my offer to meet with anybody to review the exam. So get in touch with me. Give me a couple of days and times that will work. Okay. Questions? What questions do you have so far? So today we're going to do the quiz. Then we'll review the quiz. And then we'll cover the contents of weeks 4 and 5, since we have 2 weeks to cover. Okay, how does that sound?
Mm.
It's hard to believe next week is midweek,
Week
is halfway through. I'm going to be turning on the homework grades probably at the beginning of next week, of week 6. I turn the homework grades on to so that you guys can see how your homework is affecting your overall grade. If you're turning in your homework and doing well with that, then it should increase your grade. If you're not turning in your homework, then it will obviously decrease your grade. So far, I've only had 2 key graded assessments. We had the week 3 NCLEX and we had the week 4 case study, right? And then we'll have the week 6 NCLEX. The discussion questions are pass fail. And then we've obviously had the quizzes in exam 1. So I'll be turning on the homework grades next week. All righty. Does anybody have any questions before we get started? Okay, it's 9:10. So let's take, pardon me, let's take 15 minutes to 9:25 and let's do the quiz. It's turned on for you. When you're done, you got to stay on camera. Okay, when you're done with the quiz, you need to remove yourself from the camera and go get a drink or a cup of coffee, whatever. Just keep your camera on. Okay, I don't need to know when you're done. Just make sure you hit submit. All right, so why don't you start working on the quiz and then we'll go from there. Okay. Is anybody still working? Okay. Okay. I have several people who haven't submitted yet, so make sure you hit submit if you're not, if you're done. So we need everybody to submit before we can go through it. We have one more student to finish up and then we'll get going. Home, are you done? Yes? Okay, looks like everybody's done. Okay, so if everybody could come back on camera, that'd be fantastic. How'd you do?
Not good.
Not good.
I did
No,
okay.
it's I mean, it's easy, but I don't know. It's just, I think I have a huge problem with the prevention issues. It's like I'm thinking of I knew I had a feeling that discussing contraception was important, but then again I thought it's easier to provide them a list for, if they were pregnant or something,
Well, let's go
And
through the
then,
questions. Let's go through the questions and let's see why the answers are correct and why the other answers are incorrect.
right,
And like I've said, there we do need to get a handle on the primary, secondary, and tertiary because you're going to have several questions on each exam related to that. So let's go through that. Okay. So let me share my screen and then let's go through the quiz. By the way, did everybody get the exam 2 concept guide I sent this week?
yeah, I think so.
Okay, so that should be a good starting point as you prepare for exam 2, right?
Mhm.
Just like it was for exam 1. I think you found it helpful for exam 1, did you not?
Yeah,
Yeah. And then the other thing before I forget is next week is review sessions for exam 2, right? So you all have the master schedule that I gave you at early in the term with all the review sessions. Okay, so if you could maybe try and prioritize attending one, that'd be great. As we saw in exam 1, students who attend review sessions tend to do better. They really do. So pull out that schedule, see if it works with your busy schedules. So those are next week. So I just want to mention that. Okay. All right. Let me share. Okay. Can everybody see my screen? Yes or no?
Yes.
Yes. Okay, great. Okay. So the school nurse is engaging in a primary prevention program. Which intervention is appropriate? So what's primary?
It's to like the first thing, right? To prevent.
Prevention.
Right.
Okay, so what's the correct answer?
Discuss where and how to obtain ongoing contraception.
Okay, and why is that primary?
Because primary is when you are educated. When you
But then when you say educate, there's a question on the educate the side effects of antibiotics. So
okay,
like
with
I have secondary screening, so we understand that.
Okay,
no, what that one is wrong because it's already saying that the person has the disease already.
that's correct.
That would be
That-
tetrary. That one will be tetrary if if you would have picked that one. But the discuss is you're trying to prevent the pregnancy from happening. That's why you choose the contraception first.
That's exactly right. That's exactly right. So that's exactly right. Excellent job. So discuss and where and how to obtain ongoing contraception. We're trying to prevent something before a pregnancy, correct?
Mm-hmm.
That's why, and remember, education happens at all three levels, right?
Okay.
Education at the primary level, and I think we talked about this in quiz 1 and week 2. Don't get hung up on education being just primary. When we're doing primary interventions, we're educating to prevent. When
Mhm.
we're doing education at the secondary level, remember secondary is early screening, early identification, early intervention. So let's say you've screened, and I'm going off script here a little bit, but I want to review primary, secondary, tertiary with regards to education. With regards to secondary, let's say you've identified a group that's at risk for something. Okay, at risk for obesity, at risk for teen pregnancy, at risk for substance abuse. Once you've identified that at risk group, you're still educating them, right? You're
Right.
educating them on trying to reduce that risk, right? And then when you get to the tertiary level, they already have something. So you're educating them on how to manage. Let's say they already have diabetes, or they've had a stroke, or they're pregnant, teen pregnancy, or they're pregnant. We're educating them on how to manage what they have. Okay.
Yeah, it's prevention that I get stressed out on.
Okay.
I don't know why.
So what is A? What is that? Primary, secondary, or tertiary?
Primary.
Secondary.
It is. What did you say, miss?
Why is it secondary?
It's secondary because it's like you're doing a test, like you're screening. So secondary, well, I went into one of the other teacher reviews and that's how I got it because I was confused at too. So she told me that primary is basically like the education stage where you're educating them on how to prevent like pregnancy or a disease or something.
Okay.
She told me secondary in the question, it will have like screening, ask, survey. It will have something in that area in the answer. And then she told me tertiary, when you're reading the answer, look for the disease.
Correct.
They already have it.
Right.
Correct. So A would be secondary. Okay. What would C be?
You said it's all right. It's C is primary, secondary, and tertiary, right? Educate.
Nope. What?
Tertiary, right?
Tertiary.
Aaliyah, C would be tertiary because they already have a disease or they already have something.
Oh, that's what you asked. Oh, I thought you meant educate the word. Where would it
Nope,
apply?
nope.
I,
They
okay.
already have something. So so that's a good example of educating at the tertiary level. They already
Okay.
have something and we're educating them on how to manage. Okay. What about D? What's D?
Create a pamphlet. I also wrote on prevention also. It's like you're preventing something, you're
But
educating.
read the end of the question. If you're educating on a prenatal diet, what is the assumption?
They've already are pregnant.
They're pregnant.
So it'll be secondary.
It would be tertiary. They're already
Oh.
pregnant.
Okay.
Okay,
Mm.
they're already pregnant. Remember, P primary is for prevention. S secondary is for screening. T tertiary is for treatment. Okay, Aaliyah, you and I we can set up a session to go through this as well. Okay, let's move to question 2. So which counseling is appropriate to provide a pregnant adolescent? What's the correct answer?
Continuing using condom with every sexual contact.
Okay. That is the correct answer. Did anybody get this wrong? Or did anybody select another answer? Okay, why is B wrong?
Mm.
Because once you get pregnant, you're gonna have to change the diet that you're on.
Correct.
Right.
And what about C? Why is C incorrect?
Because you're supposed to start prenatal care the moment you find out that you're pregnant.
Correct. Why is D wrong?
Because that's really not your that's not, I just know it's wrong. Because they can get
Right.
time to
Not
decide that.
necessary.
Does anybody else want to add to why is D wrong? So
Just in case.
you don't have to have those discussions as early as possible. Okay, though we have the whole pregnancy to sort out what kinds of decisions people want to make, right? It doesn't have to happen early. Okay. Question 3.
I goofed up on
Which intervention should be prioritized for a child who's witnessed a violent crime? What is important if this was an exam question and you were using the highlighter, which I suggest everybody does, that's come up in several tutoring sessions this week. I'm not sure if you guys are aware, hopefully you are, that in your ExamSoft, you have the ability to use a highlighter. Okay, so I always suggest using a highlighter. All right, so when you read the question the first time, you can highlight a key word or key phrase or a key hint in the question. Okay, so if you were using the highlighter, or what word would you highlight here?
Prioritized.
intervention.
Prioritized.
Mm.
Right? It's asking you. So this, again, we talked about this in some other quiz questions. This is a good example of a question that there may be more than one correct. There may be a couple of answers that look correct. Okay, but it's not a select all that apply question. All right. So if you get stuck in that situation, what should you do?
Eliminate.
Go back and read the question and see if there was something in the question that you missed. You may have missed the word. If you're buzzing through the exam and not going back and reading a question a second time, you may have missed the word prioritized. Okay, so what is the correct answer to number 3?
C.
C.
Obtain a mental health counseling referral. Okay.
That, I see that now, but I don't know why I didn't see that during the test. I wrote emotional.
Did you miss the word prioritized? Yeah.
I did. I
That
did.
ended up, I think I read it.
I focused on intervention more than prioritize.
Yep. So you've got to be able to pull out the important words from the question that will lead you to the correct answer. Okay. It's not that the other answers are incorrect, but the question's asking what should be prioritized.
Miss Marvel, can you just stress on this question because it just says who has witnessed a violent crime. So as a nurse, I would be observing for emotional or behavioral developments more. Then I would seek her to get mental health counseling. That's how I looked at it. Why did I look at it that way?
I don't know why you looked at it that way, but
Like
how long are we going to observe for emotional and behavioral development issues? How long are we going to wait? How long are we going to do that?
that's true.
Right? I mean, if a child's witnessed a violent crime, the standard procedure is to get some kind of mental health referral.
Got it.
Okay.
Got it.
Question number 4. Which nursing intervention reflects secondary prevention for mental health?
Screening for depression.
Well, right. And what word gives it away?
Screening.
Screening, right? Screening is secondary. Okay, what is B? Primary, secondary, or tertiary?
Tertiary.
Primary.
Nope. Remember, Aaliyah, tertiary, you have to have something. Okay, they don't. Primary is we're teaching stress reduction techniques to young children to try and prevent. Right? So that's what B is. B is primary. What's C?
Would that be tertiary? Somebody already is depressed?
That's correct. Exactly. That's exactly. Does everybody understand that?
Mm-hmm.
We're observing for side effects of an antidepressant medication. They're on the antidepressant medication for a reason. Okay, so that would be tertiary. Correct? What about D? What's D?
Veterans, they already have PSD. Tertiary? No, arranging a support group. Arranging. Would it be primary?
Nope. You said it right the first time. They already have PTSD.
So it's tertiary. Okay.
So it's tertiary. Does everybody understand that? Okay. Which nursing assessment is most important in clients abusing oxycodone? What word would you highlight in this question?
Most important. Again, I missed it. So with my understanding, oxycodone causes confusion and or respiratory disorders. So I thought of apnea, but I just wrote confusion.
What kind of question is this?
Nursing.
What do you think about what this would be an ABC question, right? Safety question,
Breathing.
right?
Apnea.
So apnea would be the
Right.
most important side effect that you'd be looking at. It's not that the others aren't correct, but it's asking for the most important.
Got
Right?
it.
So you have to think safety here.
Love you.
This is an ABC question.
Priority and most important. Got it.
Okay, question number 6. Which reflects tertiary prevention in
It
substance
is now. I
abuse?
just fixed it.
Arrange and addict LED support groups to promote recovery.
Okay, hang on. I have 2 students participating. I really would like others to participate, and you really need to keep your cameras on. Okay, I can't see everybody when I share my screen. So if everybody could turn their cameras on, and I'd like for other students to participate as well. Okay? Yannette, that's okay. No. No. I appreciate all the participation. I would just like others to participate as well. Yannette, could you please turn your camera on? Okay, let's go back to question number 6, which reflects tertiary prevention. What's the correct answer here?
Arranging addict-led support groups. So they're already they're already addicts.
Exactly. Exactly. Okay. What is A?
Hang on. A is screening is secondary.
Correct.
B is providing children information regarding substance abuse. Would
So
that
what
be
is B?
prevention?
B is
Professor, I'm
pro-
sorry. I have problem with my computer, okay?
What? Oh, there you are.
Yeah, I have problem with my computer.
No worries. No worries. What is B?
Providing children the would it be A, prevention?
No, hang on, Aaliyah, hang on. We already said what the correct answer was.
Yeah,
Okay,
yeah.
C is the correct answer. What I'm asking, I'm going through each of them.
Right,
Okay,
right.
what is B?
So
Anybody else want to jump in
Would it
here? What is B?
Would it be
Primary.
primary?
Go
no, it's
ahead,
tertiary.
Regina. Hang on, Aaliyah, hang on. Go ahead, Regina.
Would it be primary?
Yes, why would it be primary?
Because you're trying to like give them like information maybe to prevent
Yep.
substance abuse.
Yep, yep.
Mhm.
Okay, and what would D be? Can somebody else
Tertiary.
jump in and answer why D, what would D be?
Helping parents role model adaptive coping mechanisms. Helping parents role model.
Is it how you
Be,
say it, tertiary?
No, it wouldn't be tertiary.
would
That
it
be
be
primary?
Primary,
primary?
it's primary.
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 It's
Yep.
part of education.
Go ahead, Sibi. Why would it be? Why would
It's
it
a
be?
part.
Go ahead.
D is primary because it's part of education.
Correct. Correct. Everybody understand that?
Mm-hmm.
It's part of
Some-
educating before the disease happens, is where people was getting messed up at in the beginning. It's
Correct.
before the disease happens.
Right, Teresa. Exactly. Okay, number 7, we get into ethics. First of all, what's non-malfeasance? Before we even answer the question, what's non-malfeasance?
No harm.
Go
It's
ahead.
When you do no harm.
Do no harm. That's exactly what it is. There's a couple of ethical principles that we'll cover in our content in a little bit. Non-malfeasance is really important to know. This is do no harm. The other ethical principle is beneficence.
Mm-hmm.
Okay, and beneficence is do good. Okay, those are two ethical principles that, I mean, we practice these as nurses.
COVID. The second one was COVID, that we locked everybody up for a reason, for the end result. Right?
Pardon me?
The second word you said was beneficence, is because like how in COVID we locked everybody up. It's because the end result was not to spread the germ, so we did a good thing, right?
Do good.
Yeah.
Correct. So our nursing profession guides us by those two primary principles, non-malfeasance and beneficence. When we take our oath for nursing, we take our oath to do no harm and do good. That's what ethics is all about. Okay, doing what's morally right. Okay, so which nursing intervention in question 7 reflects non-malfeasance?
So Miss Marvel, I chose the second one because you can't put it's invasive. Putting a feeding tube is invasive. Somebody can swallow. That's why I wrote it. But the correct answer is using a new urinary catheter. Is it because of the infection?
Hey, so A, the correct answer. Can somebody help Aaliyah with why A is the correct answer?
Mm-hmm.
Because you want to do no harm and that one's contaminated. So you get a new one.
But then again, inserting a feeding tube is also harmful for somebody who can eat. Why would you do
Correct. So hang on, Aaliyah, hang on. If you were to insert a feeding tube to administer medications for a client who can swallow normally,
Right.
You're doing harm.
But
Right?
that's
You're
invasive, right? That's invasive, no?
no, hear me out. Okay.
Read the
You're
whole thing.
non what?
I'm telling her to read the entire sentence and then think about it before responding.
Inserting a feeding tube to administrator meds in a client who swallows normally.
Right. Is that bad or good?
That's to me is wrong.
Correct. So here, Aaliyah, hear me out. Hear me out. Non-malfeasance is doing no harm. And so A is doing no harm. You're trying to do no harm. You're getting a new catheter kit because you've contaminated the field. Hang
I
on,
get it.
hang,
I get it. I get it.
Aaliyah,
get it.
hang on a minute. The rest of these are actually doing harm.
Got it. I got it.
Okay, so inserting a feeding tube is doing harm. Failing to document an observed side effect is doing harm.
Okay.
And then maintaining confidentiality of a fellow nurse who is working under the influence, that's doing harm.
Got it. I understand. I guess I didn't know the word. I understood the word.
That's okay. 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 All right. Does everybody understand that question? Okay. Question 8, hospice. Okay. The hospice nurse notes the client's pain is poorly controlled despite a fentanyl patch as needed and sublingual morphine. Which intervention is appropriate? I need
Is-
somebody else to hang on, Aaliyah. I need somebody else to jump in here. Okay.
Notify the healthcare provider of the need for additional pain management.
That's right. Thank you. Why is that? Why is that the correct answer?
Because you're not worried about hospice patients becoming addicted. The point is to keep them comfortable and pain, and as least amount of pain as possible.
Mm-hmm.
Yep. In A, we're not worried about addiction.
We're not.
Okay. In C, with C, we
don't-
are, Aaliyah, hang on a minute. Let me finish talking. Okay. Hang on. Okay. Counsel the client that a pain-free death should not be expected. That's an inappropriate statement to a client. We would not say that. Okay. And we all know what, somebody tell me why removing the fentanyl patch and replacing it with a fresh one in the same location, that we would not do that.
You're
Okay.
supposed to rotate them.
You're supposed to rotate them. Exactly. So that's why the other answers are incorrect. Okay, question 9. So the client tells the hospice nurse, "I do not understand why God is punishing me." Which response is appropriate? What did you guys come up with this?
Do you have a pastor I can call for you?
Okay, why is that the correct answer?
Because she's already stating that she thinks God is punishing her, so she believes in God, so she must have a pastor.
Okay. I hadn't thought about looking at it that way, but that's exactly right. As hospice nurses, you're not prepared to have every conversation with a dying patient, right? I mean, yes, you're educated. Yes, you go through additional training and certifications to be a hospice nurse, but there are some conversations that are best left with a spiritual leader that they trust. Okay, a lot of students choose D. Okay, and so we have a discussion when this comes up, but B is the correct answer. Okay, and Caitlin articulated it very well.
But why would they choose D? Because you don't question them. They're already in that state of mind. We're not supposed to question.
I'll tell you why students pick D, because one of the things we've already talked about in this class is acknowledgement. Okay, they want to be acknowledged. What makes you think you're being punished? Okay.
Okay.
But when we get into the hospice part of nursing, it has a different narrative. Okay. If we were to choose D, what makes you think you're being punished, then that potentially gives the opportunity for the client to start to share things that maybe they don't want to share. You're acknowledging what they're saying. Does that
I
make
chose that
sense?
one because I thought you're supposed to do open-ended questions, but
That's
I
what I
understand
Ex-
how you guys are
Mhm.
explaining it now, though.
Exactly. Exactly. Everybody hear what Kayla just said? That's exactly right. Yep. Open-ended questions, therapeutic communication. Well, when we're working with a hospice patient and it's different. Okay. Question number 10. A client with metastatic cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects a respect for the client's autonomy? Autonomy is another ethical principle. What's autonomy?
They have a right. We should not take that right away.
Okay. Autonomy is, yes, is the patient's right to make their own decisions. So what's the correct answer here?
A.
Okay. Why is the correct answer A?
Because it's their decision. They want to stop treatment and we would just be there to support them.
That's exactly right. That's
Right.
exactly right. What about B? Why B is inappropriate. They've already said they want to stop therapies. There's no reason we would have a discussion about radiation. Right? C, we're questioning their judgment. We're questioning their decision. We would never say this. Okay. And again, D is incorrect because they've already said they want to stop treatments. So we would not be talking about chemotherapy. So Aaron's correct in saying we support them. They've made their decision. We support them. Okay. And do they need help sharing with their family? Okay. Okay. Questions on the quiz. Does that make sense? Going through it like that. What's correct, why it's not correct. All right, let's go back to, I'm sorry.
It's fantastic. I love it.
Okay. Let's talk about special vulnerable populations. Actually, in this class, most of this class, we talk about special vulnerable populations. In preparing and doing your reading, we know that special vulnerable populations are often at risk for poor health outcomes, correct? What kinds of challenges and barriers for these vulnerable populations make them at higher risk? How do vulnerable populations become vulnerable?
Lack of education, lack of medical insurance, poverty. A few things make them vulnerable.
Yep. Absolutely. Anything else? Maybe mental health, maybe mental illness, maybe substance abuse, maybe chronic diseases, maybe lack of family support, lack of social services in their community, not knowing how to access. Okay, poor living conditions, poor nutrition, maybe crime and violence. Okay. They didn't get there without, they haven't become vulnerable without challenges that they've not been able to meet, right? So the first special vulnerable group is pregnant adolescents. Okay. We know that there's a direct correlation between poverty and poor health outcomes for this group. Okay, one of the biggest issues with teens is they're very likely to drop out of school. Okay, and when we can provide, if you are working with teen pregnancy clients in the community, one of the most important things to do with this group is to try and keep them in school during their pregnancy and after their pregnancy. Why is that? Why is that? Why is education so important for this group?
So they can better their lives and get more support. They're more aware. In schools, I have school nurses.
The outcome will essentially be better if they have at least a basic education moving forward after for jobs, breaking a cycle of poverty.
Yep. Excellent. Yep. Exactly. Better decision making for both mom and baby. A better choices down the road. Okay. So one of the most important things to remember with teen pregnancy is we have to try and keep them in school. Other issues that come up is lack of prenatal care. That's a big issue. Okay, whether they're hiding it from somebody or hiding it from their family and they don't want anybody to know, so they're going to wait and seek prenatal care. Okay. The other vulnerable population within this group is homeless pregnant teens. Okay, they have a much higher rate of STDs. They have a much higher rate of addiction to drugs and alcohol, poor nutritional status, and a higher risk of poor birth outcomes. Okay, so very, very dangerous for a pregnant adolescent to be homeless. Okay. Racial and ethnic minority groups do have higher rates of teen pregnancy. Why? Well, they also have a higher rate of poverty, maybe a lack of educational opportunities, higher rates of abuse and violence. And so some factors that contribute to teen pregnancy, whether homeless or not: low income, lack of education, lack of social support networks, maybe their living environment. Maybe their environment includes abuse or trauma, neglect, sexual victimization. So let's say you're the nurse and you're doing home health visits to a new teen mom. What's that visit going to look like? What are the positives you're going to look for, and what are the red flags you're going to look for? What do you want to see? What do you want to see happening?
You want to see good nutrition in the household for sure.
Good nutrition. Yep.
You want to see if that teen has support.
Yep. Okay. What else are we looking for?
Safe environment.
Safe
living
environment.
situation.
Yep. What else? Keep going.
A bond with the baby.
There you go. Yep. That's the other thing that we must observe. That is the most important thing. Are they bonding with their baby? Okay, and what does that look like?
When the mom wants to hold the baby, wants to give care.
Responding
Nurses.
to cues. Yeah.
Yep. What are the red flags?
Not holding the baby, not wanting sleeping all day. Just not caring for the baby. I don't know.
Like a baby's constantly sleeping, neglected baby, not cared for, not cleaned up, hygiene wise and all that.
And what does the support system look like in the house? Is there support? Is there conflict? Is there inappropriate communication? Okay, we want to make sure the mother knows how to bond with the baby. She needs to have She needs to be educated and taught about growth and development. Right? Really important for her to understand growth and development for her to meet the needs of the baby, right? Here's some examples of primary, secondary, and tertiary prevention with this particular population. So primary, we could, remember, we're trying to prevent the pregnancy. So we could develop sex education programs in the schools. Well, we have developed them. A lot of them have been taken away, and we rely on the parents to have those conversations. Okay, the sooner these safe sex education conversations happen, the lower the risk becomes of an unintended pregnancy. Okay, one of the things that I used to do in the schools, especially with the high school, is yes, I would do sex education for the students, but I would also do information sessions for the parents. A lot of parents are afraid to have those conversations with their middle or high school students. So I used to bring in speakers to talk to parents about how to have those conversations at home. Okay, so that's primary. Okay, trying to prevent something. Secondary, we're looking for risk, right? We're screening for risk. Who is at risk for an unintended pregnancy? All right, so we would look at maybe a history of substance abuse, history of sexual or physical abuse, emotional abuse, living in poverty, vulnerable teens. Okay, so we'd be trying to screen who the high risk kids are, and then work with them with education, teaching on how to prevent an unintended pregnancy. And then with tertiary, they're pregnant, right? They're pregnant. So now we're at a whole different level. We have to identify what the immediate needs are. What does she need? What kind of support systems does she have? Does she want adoption information? Does she want abortion information? Is she going to go back to, is she in school? If she's not, is she going back to school? Does she have the appropriate community resources she might need? Has she had a prenatal? Does she have a doctor? Okay. So yeah, pregnant teens are a percentage of the vulnerable population in the community that you may be working with. We actually had a whole school in our district. We had such a large district. We have 90,000 students that we had a particular school that it was a high school. It housed students who weren't pregnant, but also had a program in the school for pregnant teens around the district that they could go to. And there was actually an OB nurse on site. It was like an OB clinic that these kids could go to, whether they needed their prenatal care, needed prenatal vitamins, needed guidance on nutrition. But they are really in need of support, our teen pregnant moms. Okay. Next is the LGBTQ population. You had a really good, in this particular week, you had 3 good teaching Canvas sheets. Okay, I don't know if you've seen them yet, and you know where to find them, right? They're built right into your modules. You had an excellent one on pregnant adolescents, LGBTQ, and mental illness. Okay, so if you haven't read those, please have a look at those. Okay, when we work with the LGBTQ population, what are some important factors to consider?
Don't judge them.
Mm-hmm.
Using their correct pronouns to establish trust So they talk to you.
Yep. One of the most important things that we have to start off with is knowing what our own feelings are. Right? We have to sort out our own feelings because we have an obligation as nurses to provide culturally competent care to LGBTQ families. What do I mean when I say culturally competent care? What does that mean?
We have to keep our own beliefs aside and treat everybody the same way culturally. They can come from different cultural backgrounds.
Okay.
More accepting. Don't be judgmental.
Okay. So there are nurses that may feel a certain level of discomfort when talking with the LGBTQ population with regards to their sexual orientation. All right. So we have to work with if you are one of those people who may be uncomfortable, you really have to work through your own issues and your own feelings. Because like Aaliyah said, and like Caitlin said, right, you have to be able to provide them a safe environment to discuss whatever they want to discuss, right? Understanding our own feelings, right? If you're working primarily with this population, you should have an understanding of what the laws are in your state, right? What laws or what accommodations in your state? Well, what does this population have? How are they protected? Okay. So open, non-judgmental, to be able to take an open and non-judgmental health history starts the process of building trust. I think Caitlin said that, right? Rather than making assumptions based on appearance or sexual behavior, you need to ask open-ended questions. So here's some examples in this paragraph. Right. So if we're asking questions that are trying to not assume heterosexuality, like, do you have a boyfriend? Do you have a girlfriend? Are you married? Maybe a better question would be, do you have a partner? Are you in a relationship? What do you call your partner? Okay, so we have to be careful on how we're framing questions when we're doing our assessment. Okay. Center for the CDC has recommendations for annual screenings. Okay. For this population. And you need to know this because you're going to get asked about this. So here's what the annual screenings are: HIV, genital herpes, syphilis, gonorrhea, and chlamydia. Okay. Those are your annual screenings for this population. That's what's suggested. If a particular client within this population is more at risk, okay, such as, let's say they have multiple or anonymous sexual partners, or those who are using illicit drugs in conjunction with sex. Okay, the recommendation is for those screenings to happen every 3 to 6 months. Make sense? So be aware of the CDC screening guidelines. Okay. Mental illness is the next topic. Mental illness is a huge issue, huge, and getting bigger, right? There are a few disorders or diagnoses that I want you to be familiar with. We know that anxiety is part of it's expected. It's a common emotion, right? However, when your anxiety becomes out of control and is so debilitating that you cannot function, it's going to become a problem. It's going to move into a more generalized anxiety disorder. Okay, so the few that I want you to know about here, first one is generalized anxiety disorder, GAD. Okay, this is somebody who experiences persistent, unrealistic, excessive worry about 2 or more life circumstances for a period of time over 6 months. And think about it. Generalized. They're thinking about lots of things. They're anxious about lots of things. Okay? It usually develops slowly, but it's chronic. Right? Somebody with generalized anxiety disorders worries way more than the average person, worrying about everything. Okay? The second one is a phobia. Okay? Phobia, excessive, irrational fear of a something, activity, situation, or object. Right? The fear leads to extreme anxiety, interferes with normal responsibilities. Okay? Some people maybe have fear of heights, fear of spiders, claustrophobia. Okay? And then we have OCD, which is obsession. Obsession, recurrent, intrusive thoughts that they cannot stop thinking about. And these thoughts create extreme anxiety. Right? A compulsive act that the person feels compelled to perform. Okay? And then PTSD. Okay, some previous event that either threatened death or serious illness or injury, either to yourself or others, in which you experienced intense fear, helplessness, or horror. Okay, a lot of veterans suffer from PTSD from their active duty. Okay, and then the remembrance of events on certain days or certain triggers that bring you back to that particular event. Extreme stress, extreme anxiety, nightmares, flashbacks. Okay. I know for me in the schools, the last 5 years in the schools, I saw mental illness increase exponentially. And the biggest surprise for me was how younger the children were getting. We're talking preschool, kindergarten. Okay. Children, remember this. Children are at the highest risk for mental disorders. Why do you think that is?
Is it the family history?
Family history, that's part of it. Yes. What else? Why are they at risk?
Their environment,
Their what?
their environment, like where they're
Environment? Absolutely.
All the crime, the high crime that's going around now.
Yeah.
And some of them, like you said, drop out of school due to their poverty level, lack of education.
Maybe they're
Also
victims.
still,
Go ahead.
yeah, they're also still growing and developing too, and they start to internalize things and they're developing their own personalities. And when if this is their life and their environment, it's that kind of hardwires their brain for stress and trouble.
They don't know how to reach out, like they don't know where to get the resources from or talk about things.
A lot of times they don't have an advocate, right? When they're struggling in school, that's where a lot of these kids' mental health issues come up or are observed in the school setting. Okay, and then you start to investigate and talk about it, and you realize that maybe they are living in poverty. Maybe they are witnessing violence at home. Maybe they are being peer pressured to doing something they don't want to do. Right? Child abuse, neglect. Maybe there's domestic violence going on. All right. So remember that children are at the highest risk. Okay. They can't advocate for themselves.
Yeah.
Right? The one drug I want you to be aware of is lithium, which we use to treat for bipolar. Okay. So let's say you're discharging a client from the hospital has been placed on lithium. They've been diagnosed with bipolar, placed on lithium, right? Which is a mood stabilizer. What are some important teaching points with regards to discharge? Okay, here I've highlighted this in yellow. Couple things: encouraging normal salt intake, report any diarrhea, vomiting, tremors, or lack of coordination. Those are the main side effects we worry about when somebody is starting lithium. Okay. The other special vulnerable population, we've talked about teen pregnancy, we've talked about LGBTQ, we've talked about clients with mental illnesses, but we need to talk about alcohol, tobacco, and other drug problems. Okay. Big problem in this country. Okay, alcohol abuse, tobacco abuse, methamphetamine abuse, cocaine abuse, all different kinds of things to abuse. Okay, we know that substance abuse contributes to teen pregnancy, contributes to violence, contributes to HIV, STDs, domestic violence, child abuse, car accidents, fights, homicide, and suicide. And what jumps out to me that you're always reading about is this fentanyl. Fentanyl and the overdoses, the amount of overdoses we have in our country with illicit drugs. Okay. Factors contributing to substance abuse. What factors contribute to substance abuse? Maybe a family history. Think about social environment, physical, hereditary, right? Maybe you live in a community that has a high gang violence rate or has a high violence rate, period. Maybe they come from a community that lives in poverty. I mean, think about poverty. Poverty affects everything. Okay. Behaviorally, the choices that people make, their own choices. Right? The pace of life, the stressors of life, whether you're employed or unemployed. I mean, there's many reasons for substance abuse.
Like what about like past work injuries or something? The pain medications end up leading to like the addiction of the
Absolutely.
heroin and stuff.
Absolutely. What I want you to recognize is that substance abuse is a very huge issue in all of our communities. And we probably, all of us, have been affected by it one way or the other. Whether it's ourselves, our family members, friends, coworkers, we've all been affected by it. Okay, here's some terms and definitions to read through. You don't necessarily have to memorize them, but the difference between substance abuse, drug dependence, drug addiction, alcoholism, polysubstance abuse, right? When you're taking multiple drugs. What are some psychoactive drugs? Well, we have depressants, we have stimulants, and also energy drinks. Think about the abuse of energy drinks, right? Nicotine, tobacco, vaping, E-cigarettes. What's the biggest risk with vaping to kids?
Premature lung damage.
Yeah. And that oil from vaping is poisonous to kids. It's poisonous. All right. So if a parent, I think this came up on exam 1, if a parent, you're working with a family whose kids have asthma, and you're trying to help the family, and the parents smoke, and the parent says to you, yeah, I don't really smoke anymore, but I vape. I use e-cigarettes now. Is that okay?
No.
No, that is not okay. Alcohol, big, costs billions and billions of dollars a year. Lost productivity, property damage, medical expenses, accidents, family disruptions, abuse, neglect, domestic violence, cocaine abuse, amphetamines, methamphetamines. This is a long reading section. I'm going through it quickly, but the overall discussion is substance abuse, which includes alcohol abuse. The other thing is, usually somebody with substance abuse, whether it's drugs or alcohol, usually has a comorbidity of maybe a mental illness. Those two go hand in hand. And here's some community-based activities aimed at substance abuse prevention. We did a lot of substance abuse prevention education in the schools, a lot. And so here's a list of ideas for community activities to try and prevent substance abuse, at least with the school setting. That's what I was involved with. But there's also substance abuse needs to be with the adult population as well. And a lot of times when you have addictions to substance abuse and drugs and alcohol and or mental illness, that's very high risk for homelessness. Very high risk, right? Some high-risk groups that may suffer adverse health outcomes or be at high risk for addiction are adolescents experimenting with drugs and alcohol, right? Marijuana, opiates, right? We know that heavy drug use interferes with normal growth and development. Comorbidities of psychiatric issues, we talked about that. Family problems, victimization, genetic predispositions. Does your family have a history of drug abuse or alcoholism? Okay. Pregnant women, fear of losing their kids, stigmatization, fetal alcohol syndrome, low birth weight. And then your injection drug users, risks of overdose, contaminated needles. And then we hear a lot about this lately, the contamination of the drugs. Right? So substance abuse, addictions are really, really a very serious problem. And if you're working in public health and community health, you're going to be exposed. This is going to be a common exposure, right? And actually in anywhere you work in nursing, anywhere, you're going to be working with clients that have substance abuse issues. Right? All right, let's switch gears here and talk about hospice and palliative care. What's the difference between hospice and palliative care?
Hospice is when you go like home on comfort, like all medications are stopped and you're more focused on the comfort of the patient.
And which one is that?
Hospice.
Okay, what's palliative? Okay, what's palliative care?
I think palliative is more so when like you can still get treatment,
Mhm.
although you're pretty much at the end.
There's
Yeah,
no
there's a
aggressive treatment.
There's a difference between palliative. I mean, they're lumped together, but like Kayla said, palliative care is, let's say I'm diagnosed with cancer today, but I'm given 6 months, 12 months to live. That during that time, that's your palliative care, right? Once you move into the end stages, it becomes hospice care. But the terms are used interchangeably. Okay, so when we're taking care of clients that are in palliative hospice care, so some of the most important things to consider is keeping the client comfortable, trying to maintain dignity and self-esteem, right? We know that pain control is a big part of hospice care. However, it is not necessary to keep the client so sedated that they don't even have a clue of what's going on or who's in the room visiting with them, right? We do want them interacting with family members. We do want them participating in care decisions. We do know that family needs are very important. And the hospice nurse is working with the whole family unit. But we also have we always have to keep the client's needs. Right? That was your last quiz question. Right? The client has said, I don't want any more treatment. We have to honor that. Okay. So the goal of hospice and palliative care is to alleviate suffering as much as possible. Okay. Our clients and our families in hospice care need to understand that there is no cure. Okay. We are focusing on improving the quality of whatever life is remaining versus the quantity. Okay. In addition to, symptom management, right? A lot of clients want spiritual support, psychological and spiritual support. And that was another one of your quiz questions. We need to be attuned to that and be able to be their advocate and seek out whatever support they're needing, especially if it's spiritual support. You had a question about that as well. One of the things that's important to recognize with a hospice client is dehydration. Sometimes dehydration in the terminally ill client has actually been shown to decrease their pain, right? And they're more comfortable. They're not getting those tube feedings. They're not having that oral intake. Okay, so that's an important factor to consider. Hospice care, palliative care is provided in lots of different settings. Hospice care usually is provided in the home. Palliative care and hospice care may be provided in long-term facilities, clinics, homes, or assisted living homes, long-term care facilities. All right, so hospice is for the end stage of life. Okay. So according to the World Health Organization, the goal of palliative care is to improve the quality of life, right? When they're dealing with a life-threatening illness by reducing, so it's more palliative care is more symptom management. So some of the things we would be considering as far as physical support, trying to alleviate their pain, trying to reduce their air hunger, trying to improve their sleep. Some social support tasks that we could be doing. facilitate relationships that may be strained within their family. Okay, that the patient has verbalized that they want to try and mend. All right, saying goodbye to loved ones. A lot of times when you get into palliative and hospice care, not everybody's in agreement of what should happen, right? If the client is able to clearly define how they want this end of life care to go, the family needs to support that. If they don't, it's the client that's making that decision. That hospice nurse needs to work with the family going through those stages of grief. And everybody's at a different stage of grief in these situations. Right? Have a look at this paragraph. This is your stages of grief. You're going to get asked about that on exam 2. Given a scenario and asking what stage of grief the client is in. Okay? We want to do our best not to remove the autonomy and decision making from the client. Obviously, they're already feeling loss of control. They can't change what's going on in the process of dying. Therapeutic communication with these clients, open-ended questions, avoid making assumptions, do not offer platitudes. Everyone dies, you're not being punished, right? So this was your exam question about that. It may be open-ended questions like, what have you learned so far about the disease? What are your concerns? Is there anything you want to talk about? Do you have any spiritual affiliations? Is there a spiritual leader I can reach out and find for you? Okay. This was our one of our quiz questions as well, about pain control. It's possible and expected. We're not worried about addiction. Okay. And then as death becomes imminent, the client spends more time sleeping, appetite's fading, oral intake falls, urine output decreases, incontinence may occur. Some changes in vital signs. Respirations, the Cheyne-Stokes respirations become more frequent. Periods of apnea. Okay. The last thing to remember about hospice care is that it's draining. Providing hospice nursing can be mentally draining on the nurse. It's important to understand your own feelings, your own beliefs, your own attitudes with end of life clients, and being able to take care of yourself as well. It's a grueling part of the profession of nursing. I don't know if anybody's ever worked with hospice nurses for a family member. They are just angels. Angels. Has anybody ever worked with a hospice nurse?
I have.
And?
It's very hard. It's very hard.
Yeah. Yeah. Takes a lot of dedication and faith and spirituality of culture. Okay, so has anybody ever heard of the faith community nurse? Faith community nurse is a nurse. It's a type of community nurse that works within a congregation. Whether that congregation is a church, whether it's a temple, whether it's a mosque, a lot of religious organizations have faith community nurses within their congregation. And these faith community nurses are focused on health and promotion, teaching, and the one thing they do add is the spiritual component to their care. Right? It's a specialized nurse. Again, they're more community oriented focused. All right, they're looking at the congregation as a whole. Okay, they may be volunteers, they may be hired on by the congregation. They practice health education, health promotion. They may be the visitors to the new moms with new babies. They may provide grief support groups. They do lots of different things, whatever the congregation needs for them to do. All right. And they're incorporating the spiritual and religious practices. Right. So it's kind of a focus on holistic health, body, mind, spirit into the health approach. I also want to mention, I'm going backwards now up here, you need to have an idea of time and cultures. What I mean about that is there are some cultures that are present oriented. There are some that are past oriented, and there are some that are future oriented.
What do you mean by that?
Well, let's have a look. So regarding time, cultures are considered to be focused on future, past, or present. So past-oriented cultures value their ancestors, and in the past can sometimes have a preoccupation with past events that makes it difficult for them to achieve their future goals because they're focused on the past. Okay? Present-oriented cultures, that's the here and the now. They're prioritizing their current quality of life, and they're making decisions that make them happy in the present, not really thinking about the future. Right? And being present-oriented may lead to decision-making that fails to plan for the future or consider future consequences. And then you have future-oriented cultures. If you're always focused on the future, you're more likely to make sacrifices now in order to achieve your future or long-term goals. So I just want you to be aware that we have present-focused cultures, past-focused cultures, and future-focused cultures. And each comes with their ups and downs. Okay? Ethics. First step in ethical decision making. Okay, let me back up. We are practicing ethics in all facets of our lives, are we not? Ethics is making the right decision to do morally right, morally good. We are doing that in our workplace. We are doing that in our family. We are doing that at home. Okay? Ethics, we're always involved in ethical decision making. Right? Just isn't in the workplace. Okay? So when you're the first step for ethical decision making is obviously there has to be an issue. Think of nursing process. Assessment. You got to have an issue. Okay? Then you obtain the facts. This whole first paragraph is going through the ADPI for ethics. Okay? First is you identify whatever issue you have. Then you have to investigate, get all the relevant facts, consider approaches, make a decision, implement that decision, and then evaluate your outcome. Ethical decision is very complex. Okay? It involves ethical theories, ethical principles, what it looks like to violate ethical principles. Our whole life evolves around making ethical decisions, does it not? Trying to make the right decisions. We have what's called moral distress. We've all experienced it all the time. When we're unable to act in accordance with what we believe to be the right course of action. Okay, so moral distress is a burden for all of us at one time or another. Okay, maybe it's patient assignments. Maybe it's being asked to go float to a floor that you don't know You've never been there before. You don't know really how to care for those patients. Maybe you're being asked to do something in the workplace that you know is not correct. Okay? All these kinds of things lead to burnout, lead to stress, lead to people quitting their jobs or leaving the profession. Okay? Maybe some examples of moral distress. End of life decisions. Let's say you're working with end of life clients and you're not sure how you feel about that. Right? Should your client, based on your culture, maybe your culture says they really shouldn't have all this medication to support their pain. How do you work through those moral issues? Like I said, patient load too high. During COVID, all the visitor restrictions. Right? So here's a couple of ethical principles. We already talked about beneficence. Requires you to do good. The most good possible within the circumstances. So ensuring adequate pain control is an example of beneficence. We had the urinary catheter in the quiz as beneficence. Oh no, that was malfeasance. So adequate pain control is an example of beneficence. Right? Remember, beneficence is doing good. The other one, so we have beneficence, we have non-malfeasance, which is do no harm. The other ethical principle here is distributive justice. Distributive justice is exactly what it says. All people should have access to the same things. Same resources, same access to healthcare. Then the last one we talked about was autonomy. So you have, it's right here in this paragraph, beneficence, non-malfeasance, distributive justice, and autonomy. Autonomy is respecting the patient's wishes. Okay? Advocacy, big part of ethics. All right, what is advocacy? It's taking the information and resources we have to help the client, to benefit the client. We're acting in the client's best interest. We are providing them with what they need, whatever situation's going on. Okay, maybe it's providing community resources. Maybe it's providing a spiritual advisor. Maybe it's calling the insurance company or the pharmacy to work on certain issues. All right, always maintaining confidentiality. So we're carrying out the preferences and the goals of the client. All right, and we're carrying that out with diligence and competence. Maybe a patient going into surgery, making sure that they understand all the relevant facts and information before going into surgery. If you're in a patient's room and the doctor's going over this consent with them and just kind of blowing through it and signing it here, sign this real quick, making sure the patient see if they have any questions. Okay, that's advocacy. Okay. If you can no longer provide quality nursing care due to whatever, moral distress or an ethical dilemma, right? You can't just abandon the patient. Okay, you have to arrange for alternative care before you stop caring for that client.
Miss
Here's an
Margaret?
example.
Sorry, would this example be of an LGBTQ? Some people are, a little judgmental. So if I did not have the same beliefs and I did not want to care for that LGBT, could I prepare and hand over this patient to another nurse? Would that be an
Sure.
example?
Yeah, I mean, if it comes down to that, yes. But the point I was trying to make is you can't abandon a patient because you don't have their same beliefs or you you're not able to care for them. You have to make arrangements, whether it's talking to your manager, your whoever's, you have to make arrangements for non-abandonment. Okay. Here's an example. Let's say you're working in home health and a client is making unwanted sexual advances towards you. Aaliyah just brought up the example of LGBTQ as well, right? You have to be able to, you can't abandon, you have to be able to pass that care on to somebody. All right. You know, you can't be objective, or you know, you can't provide unbiased care, right? Obviously, our first duty is to provide standard, appropriate standard of care based on our scope of practice, right? That's the expectation, right? The expectation is we provide high quality nursing care. That should guide us in our decision making, right? So a lot of ethical issues, and I'm sure everybody could share an ethical issue in your workplace that you're aware of. Ethical issues happen all the time, every day, all day. They happen in the schools, they happen in the hospitals, they happen in healthcare all the time. So anyway, questions? Anybody have any questions? We covered a lot today.
The notes you're reading from before the second the week 5 blueprint, is that also available? The first notes you were reading?
Yeah, that's in your week 4 announcement that I
Week
sent
4.
out in week 4.
Gotcha.
Get them every week. All right, I'm going to excuse you guys. I hope you guys have a great weekend. Thanks for hanging in there. We covered a lot of content today, but hopefully you're getting a better understanding of all the different types of nursing that are handled in the community.
I have a question. When is like the best time for me to try to, or am I able, when can I schedule a review to go over like the rationales for?
Yep. 1 second. I'm going to excuse, if anybody wants to stay on and ask me any questions, I will stay on. For the rest of you that don't have any questions, you're excused, and I hope you have a fantastic weekend.
Thank you.
Okay. Okay. All right. Okay. Do we need to schedule something?
Yes, I want to go over my exam because I need to know like how can I better improve on it for next time.
Oh, okay, great. Why don't you send me an email with some days and times next week that will work for you?
Okay.
Go through your school skit. What?
When is our next exam then?
Week 7.
Okay.
Next week is reviews. You already have the study guide. I've already sent that out. So next week, look at your calendar for reviews that I sent out. There's 3 live exam reviews. And then you have the exam the following week. But
Okay,
let's go over exam 1. So send me
Okay.
some days and times that work for you next week.
Okay, thank you so much.
Okay, you're welcome. Have a good weekend.
You too. Thank you.
Okay,
Bye-bye.
bye. Okay, Sibi.
Yes, ma'am. I also have the same problem. I need some time for that.
Okay, so send me some days and times next week that will work.
Yeah.
And we'll go through the exam.
Because I don't know. I tried to read this so many times. I never been like this below 70. No, like 70 or 80. I always maintain B plus. But I don't know in this class what happened to me.
Huh. Did you use the study guide?
Yes, ma'am. I usually read everything 3 or 4 times, but I don't know.
Well, let's set up
I'm
a time.
basically I'm a
Let's set
good
up.
student. I got above 90% in every exam. Even HESI also I'm getting 90%, but I don't know here
Huh.
what happened to me.
Okay. Well, let's set up a time to review the exam.
Yes,
Don't let this ruin everything. We'll figure out what
yeah,
happened.
I'm really, I don't know, I'm really disappointed because I gone through everything what you gave us, but I couldn't understand what is the basic concept.
All right, let's set up a time to meet and we'll go through it.
Yes,
But we'll get you going forward. Don't worry about it. We'll get you going forward and
okay,
figure out what
thank you.
happened.
Okay,
Okay.
thank you.
All right, have a good
You
weekend.
too,
Okay,
you too.
bye.